Hi, this is Dr. Jonathan D. Hall coming to you from Boston. Today we're going to talk about Ozempic Batwing arms, how to fix them, what you need to know, and which is best for you, the posterior incision or the inner arm incision. So here's a cute Pomeranian with bat wings, but not those bat wings. And this dog doesn't really look happy wearing those bat wings. And my dogs, Ranger and Charlotte, my two collies, said, "No way are we going to wear bat wings. These bat wings." So nobody likes having this extra skin hanging down when they're at the gym or wearing short sleeves, and school teachers especially hate having the skin swinging back and forth when they're up at the blackboard. So if someone's had significant weight loss, they're going to end up with some loose skin. And so whether that's from diet or bariatric surgery or now with the semaglutides. So 1 out of 8 people in the United States have already been on a semaglutide. They're in the newspaper headlines every day. There are at least 16 more varieties in the pipeline. There are injectables, there are oral ones, Wegovy, tirzepatide. So, what are these? So, a semaglutide is a glucagon like peptide that acts like GLP-1. This is a gut hormone that we have that helps with our glucose regulation by various mechanisms, but it also helps patients to lose weight by lowering their appetite and slowing down digestion. So patients feel full sooner and have been losing remarkable amounts of weight. So after weight loss, you can have volume loss and loose skin throughout the face and body. So people call Ozempic face weight loss in the face. There's saggy breasts, loose skin of the arms, back, abdomen, and thighs. And we can add fillers in the office to treat Ozempic face, but usually people need surgery to treat loose skin in other areas. Many patients choose to do their arms first because they can't hide their arms as easily in clothing as they can loose skin of the breasts or abdomen. So, what about no scar lifts or mini arm lifts? So, there are machines to tighten skin, and they sound very appealing, but in my experience, they have very limited indications. There have been many different technologies over the years. There seems to be a new one every year at a plastic surgery meeting. And the concept is to heat skin enough for the collagen to shrink, but not enough for skin to burn. Again, the technology sounds incredible, wonderful sensors. There are also other devices that core out lots of little holes in the skin that are small enough that they can heal without a scar, with the idea that the skin's going to have less surface area as it heals. And I've looked closely at these technologies over the years, and I haven't found one that reliably gives more than a little tightening of the skin. The question isn't whether you can do a procedure, it's whether the average person is likely to be happy with the typical outcome. So, brachioplasty comes from the words brachium, which is Latin for the upper arm, and plasty, to shape or to form. And the catch 22 is if the elasticity of the skin is decreased enough to give a bat wing, then a little skin tightening is not going to be enough. So, what about a mini lift? Well, the problem is you can't correct significant horizontal excess of the skin with a small incision hidden in the axilla. So, again, in my experience over the last 34 years, very few patients that have enough skin laxity are going to get better with a mini arm lift. There's usually horizontal laxity, and you need to put a scar down the length of the arm to tighten that. So, a brachioplasty removes the excess skin and leaves the upper arms with a more pleasing and youthful contour. And the extension typically extends from the elbow to the underarm and sometimes onto the eye, the side of the chest. And so the way that we were trained is the inner arm scar approach, and this is what I did in the first 20 years of my practice. And they would say, hey, this is where the tailor hides the seam when you have a suit jacket, so that's a great place to put the scar. And it works. We've got nice results with it. Patients were happy, and the scars continue to improve for 3 years after surgery. So it trades a visible scar for an improved contour. Here's one of my patients before and after with an inner arm brachioplasty. And we try to place the scar just below the hollow of the biceps. Here's another patient showing the markings in the inset for an inner arm, inner scar brachioplasty, as well as a breast lift. And you can see before on top and after down below. In the back view, before and after, better contour of the arms. Here's another patient who had 111-pound weight loss, and you can see her arms before, an inset with the markings, and after down below. Again, a very nice contour. Um, Here's a patient. The arrow shows kind of the crinkly looseness of the skin before and after down below the inner arm brachioplasty. We did a mastopexy or breast lift at the same time, a spiral breast lift. And here's the back view. Again, beautiful contour. Patients are happy. Here's another patient with an inner arm scar. And again, brachioplasty scars continue to fade for 3 years. It's on the inside of the arm. And with the arms at the side, the scars are hidden. Again, where the tailors put the scar, the inner arm scar brachioplasty. So here's another patient with a lot of loose skin and much better contour with the inner arm scar. And you can see with the hands folded view, we have a better contour. You can see the arrow showing how the skin is tighter even from a front view, before and after, and the back view, before and after. Now, I've heard it said that it's not just the tailor, it's the fabric you're working with. And as the skin gets looser and looser with less and less elasticity, there is more stretching after surgery. So we tighten things and nips and tucks, suture things together, take out as much as we can. Then people swell after surgery. And then if there's not a lot of elasticity, there can be a little residual looseness that comes back. But the inner arm brachioplasty, as I was taught, worked pretty well for the first 20 years. But you can see on this patient who has a lot of laxity, where I've shown the arrow, she's getting a little bit of looseness back, a little relapse with her decreased elasticity. So I've been taught throughout my medical journey that doctors don't have all the answers and need to keep searching for a better way. When I graduated from medical school, they said, half of what we taught you is wrong. Now it's your job to figure out which half. And my mom leaned over with a twinkle in her eye and asked if I was going to get back half my tuition. But the point was that, again, even medical knowledge is imperfect and to keep learning. And then when I got to University of Michigan, Dr. Dingman, who is a world-famous plastic surgeon at our University of Michigan, and one of my professors always said, if I come back in 20 years and you're still doing things the same way I taught you, I'm going to be disappointed. I have this plaque on my desk from Michelangelo, who when he was 87, was supposed to have said, Ancora imparo, I'm still learning. So I keep trying to learn and get better in my career. So after 20 years, I knew a few plastic surgeons who had an extensive experience, and they were starting to talk about this new approach to brachioplasty at our meetings. And I always wondered, is there a better way? So the posterior incision brachioplasty. So after 20 years of performing the inner arm scar brachioplasties, I decided to try the posterior incision brachioplasty. And this is my first patient 11 years ago. He's got a lot of loose skin. He's 60 years old, lost 125 pounds with the gastric bypass, and has severe skin laxity. And we might expect him to have more recurring looseness because of the poor skin quality. But here he is, also had gynecomastia surgery at the same time. And you can see before and after, and it almost looks like his arms are photoshopped. The skin is just tighter, better contour. And the back view, there is a scar at the back of the arm, but it really didn't bother us as much as we thought that it would. And with his arms up, again, really nice, tight contour, and better contour in my experience. So why is that? The geometry is different. The arm is not a cylinder, it's more of an ellipse. My theory is that by putting the incision on the wider part of the arm for an inner arm brachioplasty, there's more of a surface area to swell and stretch the skin after surgery than with the posterior incision, which is on the bottom of the arm and has less surface area to swell. So I think that's why the posterior approach may give us a better contour afterwards and less relapse. Here's another patient. This is my second patient, and posterior incision, again, markings before and after. You see it a little bit, but honestly, it doesn't bother the patients. And in fact, patients see it less because they don't see it with their arms up, and they don't really notice it with their arms at their side. And here, with her goalpost view, you can see beautiful contour. Again, really tight. It almost looks like it's photoshopped. It's not. And again, posterior view of the posterior incision brachioplasty. So I started to adopt this in my practice. And here's a patient, a teacher in her early 40s with 140-pound weight loss, and teachers really hate having that skin swinging back and forth when they're up at the blackboard. And we're going to do a bra line back lift at the same time, so she's marked for that. So here she is afterwards, and you can see the posterior incision, healing pretty well. And with her arms up in a goalpost view, excellent contour. And before and after, above and below. And the posterior view, again, beautiful contour, beautiful shape to the arms, and really not much recurrent stretching despite having lost a significant amount of weight, 140 pounds. Here's another patient who's in her mid-50s, has lost 170 pounds. And you can see here are her markings before. We did a mastopexy at the same time. That can be combined with a brachioplasty. And here she is above and below, before and after, and beautiful, beautiful result. Posterior view, again, an excellent result. And the arms down view, you can see the scar a little bit from the back after 6 months, but not bad. And again, that scar is going to keep fading for 3 years typically. And it just doesn't seem to bother patients the way that I thought that it would, and they like the better contour. So again, here's another patient in her mid-60s with a 100-pound weight loss. And you can see the markings here. You can see after, before and after, excellent contour. And you can see the posterior view before and after, again, an excellent contour. And with her arms at her side, you can see where the arrow shows kind of the crinkliness and looseness of the skin before and after, and it looks better even with the arms at the side. And with the hands folded, again, before and after, see where the arrow shows the skin, the arms just look better. And the posterior view, there's a scar behind the arm at 6 months, but it's not bad, and it's going to keep fading. Another patient, a nurse who's 42, lost 125 pounds. And here she is before and with the markings, and she had a breast lift at the same time. So here she is originally, before and after. You can see the after view now as she's coming back to be marked for a fleur-de-lis abdominoplasty, but you can see the arms and the breasts. And you can see the posterior view, and she has a small scar behind her arm, but it's not bothering her. And at 6 months, it's settling down nicely, and it will keep getting better for 3 years. Here's the goalpost view. Again, excellent contour, beautiful shape to the arms, and from the back view, beautiful contour and a tighter contour. So today we've learned about Batwings after significant weight loss. We reviewed the mechanism of the new GLP-1 agonists, which are helping more and more patients to lose their excess weight. 1 out of 8 patients in the United States have been on GLP-1 agonists. We discussed surgical options for patients with excess skin of the upper arms, trading a scar on the upper arm for tighter skin. We also talked about why limited approaches like a mini brachioplasty and energy-based devices may not give the desired results. And we discussed my current brachioplasty preference for the posterior incision approach in most patients. So this is Dr. Jonathan D. Hall coming to you from Boston, and thanks for listening today. I've left my contact information down below if you have any other questions.